And welcome back. World Breastfeeding Week has been launched in South Africa with a call to everyone in society to play their part in creating a conducive environment for mothers to breastfeed their babies. The launch by Health Minister Dr. Zweli Mkhize comes at a time when some express concern over whether mothers can pass on the coronavirus to newborns through breast milk. To talk more about this is Dr. Chantell Witten, spokesperson for the South African Beastmilk Reserve. A very good evening to you, Dr. Witten. Thank you so much for speaking to us. So, how is breastfeeding a fundamental aspect of preventative healthcare?
So breast milk is the ideal food. It is the best food for babies. It's perfect nutrition. It's perfect immunity. And also it is brain food. So in terms of having healthy babies and healthy children, breastfeeding would be your number one option for feeding.
So as you say, it's for immune protection. It helps with the development of babies. Just kindly explain a little bit more how.
So breast milk is a living material. It has what we call immunoglobulins. So it has the immune functions. It has anti-infective functions, antibacterial and antiviral properties. So when babies breastfeed, and for the very first time that babies actually feed immediately after birth, we have something called colostrum. And that colostrum is what provides children with protection.
Now, how is World Breastfeeding Week under COVID-19 presenting itself in terms of improving the health, nutrition and development of babies? Obviously, there are some concerns that have been expressed about whether or not mothers can pass it on to their children if they do have it.
Well, independent of COVID-19, breastfeeding is the number one intervention for child survival. So we know that babies that do not breastfeed have a higher risk of dying, have a higher risk of infection, have a higher risk of disease. In terms of COVID-19, mothers are being encouraged and being supported to breastfeed because there is no risk of transmission through breast milk. The World Health Organization and our own National Department of Health has unequivocally supported that breastfeeding should be continued, that moms who are COVID positive should wear a mask, should do general hygiene, wash their hands when they handle their baby, and keep in isolation. So firstly, breastfeeding carries the protection that milk has. And secondly, it does not pose a route of transmission.
So what about anxious mothers who still think that giving breast milk is dangerous? Is expressed breast milk safer?
Yes, of course. If moms are not feeding directly from the breast, then moms can be expressing, and if they are not feeling well, then somebody else can feed the child for them. If they are feeling that they don't want to be in close contact with their babies, they can express and somebody else can feed their babies. But ideally, breast milk should be the only choice for infants under the age of 6 months.
Let's talk now about what mothers can do. How would you encourage good maternal respiratory hygiene?
Well, in terms of moms and the general public, we know that wearing a mask is mandatory. And we should be wearing our mask, and especially for moms who have tested COVID positive, should wear their mask while they are breastfeeding. The etiquette of coughing into your arm or coughing away from your baby, and then good hygiene. So washing hands every time that you handle your baby, before and after picking up your child, please wash your hands. These are the general guidelines for preventing the transmission of COVID-19.
It's interesting at a time when there are greater public health safety concerns that there are people who are still outraged by mothers breastfeeding their children in public. So how can it be done that we ensure that mothers are given the space and the resources to breastfeed wherever they are without being shamed?
So this is really something that we need to address in the context of South Africa's culture towards women in general. So sexual harassment, as we know, is a form of violence, and mothers who are breastfeeding are experiencing that harassment as well. There is no law that prevents mothers from breastfeeding anywhere, any place. And what we do need is more education. We need more engagement with society to try and change this hostile environment that breastfeeding mothers are confronted with.
And you talk about the cultural context, as in the culture that is specific to South Africa. Why is it that breasts have been sexualized, that even when a mother is breastfeeding a child, that there's cause for her to be, reason, according to those who do it, to harass her?
We've seen this. I speak from my own experience. So in the last 15 years, we've seen a significant change in the culture. So 15 years ago, it wasn't a problem to breastfeed anywhere, any place. But with westernization and the influence of media, we do see that women are being ostracized, shamed, put in very difficult positions. In the last few years in South Africa, we've seen moms that were asked to leave retail stores. We've seen moms who were harassed on flights. And so there is a cultural shift. And what we are trying to do, both as the South African Beastmilk Reserve, as well as the South African Civil Society for Women's, Adolescents and Children's Health, is to engage society in a dialogue that unpacks these new phenomena. It's westernization, it is foreign culture, it is hostile towards women and towards women who are breastfeeding. And what we are trying to do is actually engage so that we can have conversations and understand why is this being fueled.
And bring an end to the practice. Thank you so much for speaking to us, Dr. Chantell Witten, spokesperson for the South African Beastmilk Reserve. It is World Breast